Hi everybody, it's Zach Borus from the Dickinson County Board of Health and Lakes Regional Healthcare here in Spirit Lake, Iowa. It is the 20th of July and I'm going to take my mask off. But just wanted to give you a brief update on where things stand with coronavirus here in the county, as well as the state and nationally. Some of the testing opportunities here, just what we're seeing in terms of folks in the hospital here and in Sioux Falls, and some of our ongoing guidance. Not much has changed. So we are currently sitting at 335 confirmed positive cases in Dickinson County. About 60 of those are still active as far as we know. But that's over the course of the last 3 months. We have not, thankfully, seen a huge spike since the 4th of July. At the same time, that could reflect who's being tested. That could also reflect that a lot of folks came into the county and then left before they were tested or before they became ill. And really, this is probably the week that we would end up seeing a lot more cases coming to fruition, as it's been about 14 days since the 4th. So we are hopeful that there was not a large spread because people were doing the right thing for the most part, but there were also folks who were probably getting a little too close and not distancing and not wearing masks, and so time will tell, but we are hopeful. So that's a bit of good news here. As we've seen nationally, numbers are rising. That goes for Iowa as well. In Iowa, currently there are 221 people who are hospitalized. That has gone up significantly. About 3 weeks ago, there were only 120. So it's up about 100 in the last, of current hospitalizations in the last 3 weeks. And we fear that that's going to continue to rise. There are 76 people in the ICU in Iowa as well, and about 30 of those are in our region. So folks are sick, numbers are rising, and folks are getting sicker in general. Nationally, we are seeing hospitals that are full, again, sort of like we saw in New York early on, in Miami, in other parts of Florida, in Texas. Houston is blowing up. And so we think that being a more rural community where people are taking precautions for the most part, we hope that we don't see that here or even in our state. But again, a lot of that is lagging indicators based on what people were doing 3, 4, 5 weeks ago. So time will tell again. In terms of testing, we still have the Test Iowa site here in Dickinson County. That is currently at the ice rink on Zenith Avenue, and that is going to stay there at least through the end of August. Hours may be changing, so just continue to look at our Facebook page and at our social media, and you'll get the details of that. Again, you go to testiowa.com, you fill out the form, and on the last page, you go to other options for testing, and we are under the clinics rather than under a site. Still trying to get that changed on the website to make it more user-friendly, but that's where we are. You can find it. You'll get a QR code, you bring that to the site, and you get tested. Everyone who is an Iowa resident can be tested, and we encourage you to. So in terms of who should be getting tested, still about the same. So if you have a known exposure, so if someone you know tests positive, then you should probably get tested at least 48 hours from that exposure. At the same time, if you spent more than 15 minutes within 6 feet of that person without both people wearing masks, you should still quarantine for 14 days. And that is challenging, we realize that, but the CDC is not recommending retesting after a few days. It's really, be careful, especially if that person is in your household and you've had ongoing exposure, really. Unless your specific workplace has a different guideline or is somewhere like a hospital where there's very short staff or things like that, which thankfully we're not at, then you should quarantine for 14 days. Also, obviously, if you are having symptoms, you should be tested. We are still encouraging you to call our respiratory clinic at 336-6696 to be evaluated via phone and or video visit or in person, depending on what they triage you to, depending on your level of symptoms. But if you are short of breath, if you're feverish, if you're coughing, or if you have some of the lower level symptoms of loss of taste or smell, headaches, nausea, vomiting, diarrhea, muscle aches, severe fatigue, sore throat, you should probably get tested. Again, you could do that through the Test Iowa site, but we ask that you call our respiratory clinic, and they will send you to the best site. Right now, you are also probably hearing that there are getting to be more and more delays nationwide in terms of testing return speed. So we are seeing some more delays around here as well. It has to do with, again, those exploding numbers elsewhere, both in terms of people testing positive and people who are actually sick from it. And so people are being tested in droves in those hot spots. That has limited the availability of some of the reagents for the tests that go to some of our labs. So we are still getting people processed as quickly as possible. We still encourage you to get tested, and we encourage you, if you know that you've been exposed or if you're having symptoms, to quarantine. So rising numbers across the country. There were, the last 3 days, there have been over 70,000 new cases confirmed per day, and again, with that, there are more hospitalizations than we've seen for months. So it's real. Again, Iowa's not seeing a huge influx, but we're seeing more people hospitalized. Locally, we have currently 2 people in the hospital with coronavirus. In Sioux Falls, there are 2 or 3 from our county who are over there right now. We have had 4 deaths, so the website still says 3, but our 4th death was on the 10th, and I'm not certain why that hasn't been updated, but it will be. So we've seen the effects here, and we hope that that's as many as we see, but time will tell again. In terms of our current guidelines and recommendations locally, in terms of how you can protect yourself, how we can continue to keep our community safe and continue to keep each other healthy, continue to keep people working, and hopefully can open up schools as we're planning to do within a month. Really, the guidance is the same. So continue to socially distance whenever able. So try to keep 6 feet away from folks if you can, if they're not within your home pod. If you can't do that, or even in general, if you're out and about, please wear a mask. There's lots of misinformation out there, but I think people are getting it, that masking is the best way that we have to protect each other and to keep our society open. We do not want to go back to a shutdown like we had for those months in the spring. So the way that we do that is to cover our mouths and cover our noses, and masks, while not perfect, will do so. Piece of cloth, yes, it cannot keep in every single coronavirus particle because the particles are tiny. So if you're coughing, a little bit will get out, but we now know that it's more about the number of coronavirus particles getting into your airway. So if I am sick and I have a mask on, I'm going to cough, most of that's going to stay in my mask. If a few do get out, even if because it's not a perfect mask, then fewer of those are going to get to you, and if you're wearing a mask as well, very few of those are going to go through your cloth mask or your N95 or whatever other type you have and get into your airways to the point where it's going to make you sick. So it's the best hope we got. The CDC director suggested that if everybody wore masks, then we could shut this down in 6 weeks. Whether it's 6 weeks, whether it's just decreasing the number of cases dramatically, I think it's worth it. Doctors do surgery for hours and hours at a time, and they do not have any excess CO2 in their lungs. Certainly there are medical reasons for not having, or not wearing a mask. So if you are severely asthmatic, if you have COPD, if kids have sensory issues that don't allow them to keep it on, sure, I think they can do their best and try to do more of social distancing, but in general, everyone can wear a mask. There's really few, if any, cases of ill effects of them, and it's what we got to do to keep our society open. So I think there's a reason that we're seeing now Walmarts and Targets and Costco's and Walgreens and CVS and Best Buy, all of the big chains are saying, this is how we protect our customers, this is how we protect each other, and they are requiring masks in their stores. I think we'll see more of that. And just as an FYI, the Avera's position and the Dickinson County Board of Health have both taken the position that they encourage schools to reopen because we realize that there is value in in-person schooling, but they have also encouraged universal masking. Again, potentially with exceptions, potentially with doctors' excuses. So that's where we are. We are talking regularly with our local schools, with the local municipalities. We're doing our best to really keep this down and keep it out of our community and to protect the folks who are coming into contact with people who might be ill. So do your part, wear a mask. That's how we're going to keep doing this and how we're going to keep open until there's an effective vaccine. Unfortunately, the idea of herd immunity really has not played out, even in places where it's been overwhelming infection. We would need 3 or 4 times that to really get to the point of herd immunity, and the antibodies necessarily are not lingering. And so that idea is out the window a little bit. So I encourage you to wear a mask, do it for your neighbor, do it for your family, do it for your work colleagues, and do it so that we can continue to stay open. So I'll stop talking. It's great to see you all again. I hope that you're all having a wonderful Monday, and that it's a lovely week, and I'll see you